Still ahead here at 5 o'clock, as the demand for health care rises, so do insurance costs.
I sit down with our medical expert, Dr. Bose, who explains the state of health insurance.
The cost of health care and insurance is always changing. People enrolled in Obamacare can expect premiums to jump at least 20%. Medical expert Dr. Sudip Bose sits down with Tatum Gwynn to explain the ever-changing world of insurance.
Well, I don't know about you, but there's nothing more frustrating than having to deal with insurance. It's confusing.
It is, and you may be frustrated, and a lot of you guys out there might be frustrated with your health care insurance. You don't know how much something's going to cost, and when you go into your doctor, you and your doctor can't tell you how much something's going to cost. And I'm more worried than frustrated. I'm worried because if you look statistically at it, by 2030, which isn't that far away, Tatum,
No.
1 out of 2 people, 50%, are going to be obese. So between you and I, it's probably going to be me. So one of us are going to be obese, and 1 out of 3 of us by 2030 are going to have diabetes. So either me, you, or you, one of us are going to have diabetes. So in addition to that, they're aging baby boomers. So there's a big stress on our system. There's more obese people, more diabetics, and aging baby boomers incoming. And what does that mean?
More people, more demand. The demand is much higher.
And what that looks like is when you walk into an emergency room, it's overflowing, patients in the hallways, in the waiting room. So in comes health insurance. And we're not bashing health insurance here. Health insurance is a good thing. Mm-hmm. It's a pooling of money so people can save money.
Right.
So 100 people pool money, 5 people get sick, and with that pooled money, everybody save some money and it helps patients. That's ideally what should happen. But what I'm worried about out there is there's a publication by the American College of Emergency Physicians, and what that stated was that we're finding that patients are delaying their care. They're delaying it because they don't know how much things are going to cost, the high deductible, they're afraid. And the insurance companies, what they're calling cost cutting is really, if you look at the numbers, it's profit boosting. It's not cost cutting. Yeah. So they're narrowing their network plans. So all of a sudden, your doctor is not covered in the network plan. You don't have enough primary care physicians in your plan. There isn't a specialist for you out there. You get a head bleed, Tatum, and a neurosurgeon is not covered. That's a problem.
Yeah.
And then they're denying the payments. So if you come in, or you come in with chest pain, I as the physician do an EKG, a chest x-ray, blood work on a patient to make sure that it's not a heart attack.
Right.
Thankfully it's not, it's only a bronchitis. And then the claim gets denied because it was only a bronchitis. But you didn't know that when you came in.
Right.
So
then you're stuck with that bill.
Yeah, or it's denied and you're stuck with that bill, and patients should not be forced to self-diagnose their condition. This leads to dangerous insurance practices. And when you look at the Affordable Care Act, it mandated that 80% of the premiums should go to actually helping patients. Yet, 4 of the largest insurance companies had enough resources to merge. So there's a crisis looming, and don't be surprised if you're running into these problems. Many of you are. Mm-hmm. Your frustration is not alone. So just be aware the crisis is looming. It's out there. Maybe write your congressman, and you're not alone.
All right, Dr. Bose, thanks.
Thank you.